Norley, I'm starting soon lah.
Okay, we start lah on time.
Okay, sekejap Norley, I'm starting soon lah. Okay, start lah on time.
Dia macam lag Azreen.
You buka kat mana? YouTube. That one. Okay.
Okay ke? Can hear?
Alright, I start ya.
Okay.
Assalamualaikum dan salam sejahtera diucapkan kepada semua peserta yang sedang mengikuti siri webinar kita yang bermula pada hari ini. Untuk pengetahuan semua, tajuk siri webinar kita ialah Students Embracing Adversities Mind Empowerment Webinar Series. Saya ialah Dr. Nurul Azreen Hashim, moderator untuk program pada hari ini. Untuk pengetahuan semua, program webinar ini adalah anjuran Skuad Peduli Minda, Fakulti Perubatan UiTM dan Jabatan Psychiatry. Okey, ia diadakan bersempena dengan sambutan World Mental Health Day bagi tahun 2020. Okey, siri webinar kita ni akan berlangsung selama 3 hari. Jadi ini ialah hari pertama. Kita akan ketengahkan 6 tajuk-tajuk yang penting dan relevan yang diharapkan dapat memberikan manfaat kepada para peserta. Okey. Tanpa berlengah masa lagi, tajuk ceramah kita pada hari ini yang pertama ialah stress management. Okay, tajuk ini sangat penting especially for you guys students dan akan disampaikan oleh Dr. Norley Shuib. Dr. Norley ialah seorang pakar perunding psikiatri dan seorang pensyarah perubatan di Fakulti Perubatan UiTM. Suka saya nak ingatkan, jika anda semua ada soalan, boleh tunggu sehingga akhir webinar dan boleh postkan your questions. You can type in the YouTube channel. Kita akan baca towards the end dan kita harap Dr. Norley dan saya juga akan boleh cuba untuk menjawab soalan yang diajukan oleh para peserta. Okey, tanpa berlengah masa lagi, saya nak jemput Dr. Norley untuk mulakan ceramah beliau yang bertajuk Stress Management. Persilakan.
Okay, thank you Dr. Azreen. Before we start the session, can you hear me? Okay, right. Today I'm supposed to be talking to you about stress management. Okay, macam Dr. Azreen cakap tadi, it is very important, not just for students. I think it is very, very important and very relevant for everyone. Okay, right. So these are the topics that will be covered during the webinar. So we will discuss about the definition of stress, the causes or sources of stress, effects of stress, concept of self-compassion and how you deal with stress and when and where you need to get help. Okay, right. So what is stress? Okay, in medical term, stress is a physical, mental or emotional factor that leads to bodily or mental tension. So it happens when a person perceives a lack of balance between the demands placed upon them and their ability to meet or cope with the demand. Okay, and usually kalau dalam if someone is stressed ni, some of us will have the fight or flight response. Okay, in simple term, stress is our body's response to changes in our life. Okay, right. So what are the causes of stress? Okay, these are some of the causes. Okay, major life changes, for example, marriage, okay, divorce, death of loved ones, okay, ataupun there are changes in your daily roles. For example, from someone single, you become a mother. Okay, ataupun the other sources of stress which is very relevant nowadays is financial issues or difficulties, and also medical illness can be an important cause of stress. Okay, study or work related issues. Okay, when you have too much assignments or deadline to meet, for example, okay, you can no longer cope. Okay, and also when there is relationship problem. So these are some example of causes of stress. Okay, right. Different people perceive and respond to stress differently. So setiap individu tu akan basically cope dengan stress dengan cara yang berbeza and cara masing-masing. Okay, so the effects of stress ni can be positive and it can also be negative. Okay, positive tu it can be a protective mechanism, like I mentioned tadi, a fight or flight response, and it can also be a drive or motivation for you to complete your task daily. Okay, it becomes a negative effect when it is repetitive and prolonged. When you have prolonged exposure. Okay, that means stress tu berterusan. Okay, and berulang kali, and sometimes it can also lead to physical or psychological health issues. Okay, right. So someone who has chronic stress ni will experience prolonged ataupun escalating stress. That means stress tu semakin lama semakin meningkat. Okay, these are the effects of chronic stress. Okay, kalau secara fizikal, you will experience headache, sakit kepala, ada masalah tidur, okay, mungkin ada muscle pain. Okay, setengah orang akan experience increase in their blood pressure, okay, tekanan darah naik, and sometimes some people will have digestive issue. Okay, for example, someone yang ada gastric problem, if they are under a lot of stress, they will notice that their gastric problem tu akan jadi more frequent. Okay, the psychological effects of stress, you will feel that you are unable to get things done. Okay, sometimes kita ada mood swings. Okay, so sometimes you get very irritable. Okay, ataupun sometimes tu you rasa macam tiba-tiba macam nak menangis, very sad. Okay, anxiety atau keresahan, you have lack of motivation. Like I mentioned tadi, you cepat marah. Okay, some will go into depression, and some too resah, restlessness. Okay, right. Okay, how do you deal with stress? Okay, like I mentioned, okay, you cannot pour from an empty cup. That means you have to take care of yourself first before you are able to take care of others. Okay, others too, regardless. That means your friends, your family, your children. Okay, right. So, okay, we will talk a little bit about concept of self-compassion. Okay, compassion is a concept coined by Neff, okay, in 2003. So, there are three components, which is self-kindness, common humanity, and also mindfulness. Okay, right. Self-kindness ni, where you recognize that being imperfect, failing, and experiencing life difficulties is inevitable. Okay, that means every human being is imperfect, okay, and you will face difficulties and also failures in life. That is human, okay. And when you recognize and acknowledge this fact, okay, you are able to be gentle to yourself when confronted with painful experiences ataupun difficulties in life. Okay, right. Common humanity, okay, talks about being human. That means, again, you are vulnerable and you are imperfect. Okay, so when you recognize that all people, basically when everyone is facing the same difficulties or will experience difficulties, you will recognize that you are not alone. So it is part of your human life. Okay, the experiences, stress, difficulties, adversities ni. Okay, right. Mindfulness basically talks about taking a balanced approach to a person's negative emotion so that feelings are neither suppressed nor exaggerated. Okay, so it relates the person's punya personal experience to those of others who are also suffering, thus putting one's own situation into a larger perspective. Okay, right. Okay. Tips to stress management. Okay, how you deal with stress. These are some of the tips. Okay, you understand your stress. Okay, and you identify your stress sources. Okay, you learn to recognize stress signals. That means the body signals that is sent to you. For example, some people when they are stressed, okay, they will experience increase in heart rate. They have difficulty breathing. Okay, some of them are sweating. Okay, ataupun you feel a bit anxious. Okay, right, and you recognize your stress strategies, how you are going to cope with your stress. Okay, so I will talk about this a bit later. Okay, and you implement healthy stress management strategies. Okay, make self-care a priority and ask for support when needed, which is very important. Okay, right. Effective strategies to basically overcome or manage your stress are divided into action-orientated approaches, okay, emotional-orientated approaches, and acceptance-orientated approaches. Okay, right. So these are some of the action-orientated approaches. You have to be assertive, okay, that means you have to basically set limits, okay, when you want to say no, okay, right? And you have to also sometimes reduce the noise around you. Sometimes it is a good idea to disconnect from your social media for some time so that you can relax your mind, okay? Time management is very important, okay? So you have to prioritize your daily tasks accordingly, okay? And you also have to create boundaries around you, okay? Healthy boundaries around you, okay? You also have to get out of your head by taking a break or distracting yourself. Sometimes you have a lot of negative thoughts. Sometimes you have a lot of negative thoughts. So it is good for you to distract yourself by doing things that you like. Okay, right. And you also have to basically control your diet. Okay, eat a well-balanced diet and basically exercise regularly. Okay, find the time to exercise regularly. Okay, sleep is very important in self-management. Make sure you have adequate amount of sleep, maybe at least 6 to 8 hours per day if you are able to do so. And the last thing is to build resilience. Okay, resilience ni is your ability to bounce back when you are faced with stress or negative life events. Okay, so I believe Dr. Faiza will talk further on building resilience in her lecture. Okay, right. Emotion-oriented approaches, okay, are divided into affirmations and imagery. Okay, affirmations ni basically is positive self-talk, okay. That means you have to keep reassuring yourself, okay, about positive things that happen around you instead of concentrating on the negative things that happen around you, okay. And you also have to express gratitude. Expressing gratitude is very helpful, okay. You have to sometimes, maybe it will be helpful to sit and think, what are the things that I'm grateful about today? It can be small things, okay. For example, I'm grateful that today I still have my job, for example, okay. I'm grateful that today that I get to spend my time with my family, okay. So you have to start noticing things that you are grateful for, okay. And cognitive restructuring. Okay, cognitive restructuring ni a lot to do with cognitive behavioral therapy. That's why I've written that it's therapist guided, okay. Right. Okay, acceptance-oriented approaches. These are some of the examples: meditation and physical relaxation. Okay, you are also encouraged to talk about your stress, basically to the ones that you trust most. Okay, be it your family members, your friends. Okay, it's very good to have a very supportive environment. Okay, mindfulness therapy, again, it can be therapist guided, and also acceptance and commitment therapy, also therapist guided. Okay, right. These are some of the things that you can do for physical relaxation when you are experiencing stress. Okay, you can do guided imagery, okay, mindfulness exercises, progressive muscle relaxation, and breathing exercise. Okay, what I will do in the next slide, I will show you a video, a very short video on deep breathing exercise. Okay, it will guide you on how to do deep breathing exercise, and I find it very helpful. It's something that you can do quickly, and it helps you to relax if you practice it regularly. Just bear with me for a few minutes. Yeah, it will take some time to play. I got it. Okay. Sorry about that. I think you can't hear the sound. I'll try and play it again. Okay. Just stop the share. Okay, sorry, I didn't play the sound earlier, so I will replay it again for you all. Sorry, my mistake on that.
The first exercise in our relaxation toolkit involves something we've all experienced at some point or have been very close to experiencing: shortness of breath during times of stress. When we're anxious or stressed, our breathing becomes very shallow. The breath we take isn't fully drawn into the lungs, and there's more contained in our chest. This brings us to our very first exercise of stress reduction: deep breathing. It's also known as abdominal breathing, belly breathing, or diaphragmatic breathing. This technique consists of breathing through the belly and not the chest in a slower and deeper fashion. There are many physical benefits to this simple technique. Deep breathing lowers your heart rate, your blood pressure, increases your energy levels, and decreases your muscle tension and pain. not to mention the mental health benefits, including decreased anxiety and stress, as well as improved sleep and a more focused mind. Let's practice. Sit or lie down in a comfortable position. Begin by taking a deep breath in and a long, relaxing breath out. The idea here is to achieve a slow and steady breath. Go ahead and place one hand on your chest and your other on your abdomen, if this feels comfortable for you. Now try and keep your chest rather still and have your abdomen expand and contract as you deeply breathe. Some people find it helpful to count while they take their deep breaths. For example, you may count like this. In, 2, 3, 4. Out, 2, 3, 4. In, 2, 3, 4. Out, 2, 3, 4. This counting can help you with consistency. Try to practice this regularly a few times throughout the day for a few minutes. It will relax you physically and mentally during times of stress.
Okay, right. I hope the deep breathing exercise is useful for all of us to practice. Okay, whenever we are faced with stress, or actually we can do it whenever, as much as we could. Okay, right. Now we talk a little bit about self-care. Okay, like I mentioned earlier, okay, it is very important for you to basically look after yourself, okay, before you can look after others. Okay, the concept of self-care is divided into emotional self-care, physical self-care, social self-care, and also spiritual self-care. Okay, examples of emotional self-care is basically you want to, on your daily life, when you have tasks given to you, okay, you have to learn to say no. Okay, you cannot say yes to everything. Okay, if it exceeds your limit, then it is advisable for you to say no, but provided with a reasonable explanation. Okay, the other examples of emotional self-care is basically scheduling a me time. Okay, that means you do whatever it is that you like lah. Okay, for example, you like going out with your friends, okay, hanging out, having a good cup of coffee, or maybe you like going to the movies, for example, ataupun going hiking. Okay, so make sure that you schedule me time for yourself. Okay, and also sometimes it will also be helpful to reward yourself. Okay, for example, if you were to complete a certain task, okay, maybe I can go out with my friends for about 1 hour or 2 hours, or go to the movies with my friends or family. Okay, right. Physical self-care, some of the examples are basically eating a healthy diet, okay, making time for exercise, okay, and also you have enough sleep. Okay, those are some of the examples. Okay, social self-care, some of the examples are basically have a good support system. Okay, that means whenever you have problems, be it at work or in school, okay, you have a groups of friends that you can go to basically to share your problems or difficulties. Okay, and your friends doesn't necessarily have to basically help to solve your problem, but sometimes it is good enough just to have people listening to you. Okay, you will feel much more relieved. Okay, and also for those who are in a relationship, okay, always basically make a time to spend time with each other. What some people term it as date night. Okay, right. Spiritual self-care is very important. Okay, some find meditation helpful. Okay, for the Muslims, maybe saying your prayers or reciting Al-Quran will be also helpful. Okay, and sometimes spiritual self-care also can come in the form of relaxation techniques. For example, mindfulness exercises. Okay, right. Or also you can also practice deep breathing exercise. Okay. Right. Okay, to get help. Okay, these are some of the signs or symptoms that basically would ring an alarm to you. Okay, it's time for you to get help. Okay, when you could no longer cope or you feel trapped, that means you dah rasa there is no way out of this problem or this situation. Okay, when you experience symptoms of anxiety or depression. Okay, anxiety meaning that you feel very anxious all the time. Okay, sometimes it will also associated with physical symptoms. You will have palpitation. Okay, your heart is beating very fast. You have difficulty breathing. Okay, some people ada macam choking sensation or depression. Okay, depression ni you feel that your mood is constantly low. Okay, you will have difficulties in concentrating. You are no longer interested to do things that you used to like doing. Okay, you will have sleep disturbances. Okay, you will have macam feelings of hopelessness, feeling of giving up, right? Okay, and lastly is when the stress that you are experiencing is interfering with your functions of normal living. Okay, that means you are struggling to attend classes. Okay, you are struggling to basically concentrate in class. Okay, you no longer interested to see your friends. You prefer to be on your own most of the time. Okay, those are some of the examples. Okay, right. How to get help? Okay, usually these are some of the basically places or people that a person goes to when they are experiencing stress or when they need help. Friends or family usually is the first line. You will try to talk to your friends or family. Okay, the next person, maybe if you feel comfortable with your supervisor, maybe you can talk to your supervisor. Or sometimes in universities or colleges, you have counselors. You can approach them too. Okay, and there is also NGOs, for example, befrienders, and lastly, mental health professionals, for example, psychiatrists and also clinical psychologists. Okay, right. Okay, these are the psychiatry and mental health services in Klang Valley. Okay, so you will have the hospital from Ministry of Health and also hospital from Ministry of Education, and there are also private hospitals and clinic that provide mental health services. Okay, for those who need to be seen by the mental health professionals. Okay, I think that is the end of my talk. Okay, I will open it for questions on the YouTube channel. So if you do have questions, please feel free to type in your questions, and Dr. Azreen will go through the questions and we will try to address it as much as we could.
Okay, thank you, Dr. Norley, for the talk. I think Dr. Norley had covered multiple aspects on stress, and we already learned how to cope with stress, and then even watch a video on deep breathing exercise that we can practice. There's a lot of other sources on relaxation techniques and breathing techniques available on YouTube. As long as you look at the source is from credible sources, for example, done by psychologists or psychiatrists. I think you can refer to that. Yeah. Okay. So anyone have any questions? You can type your questions and we try to address it. Okay, since there's no question, maybe I can ask Dr. Norley. For example, just now Dr. Norley asked about already mentioned about where to get help. So what is the procedure that the students need to do if they find that they have any symptoms, or or they know someone that have symptoms, how to proceed to those centers, for example, to go to the hospital and to go to the psychiatrist? What can they do? What is the first step that they should do?
Okay, thank you, Dr. Azreen. Okay, if you do find that you need help from the mental health professionals, for example, psychiatrists ataupun clinical psychologists, usually our advice is for you to be seen.
Norley is mute. Norley to mute. Norley, you are mute.
Yeah, wait.
Okay.
Okay, right.
Okay.
Can you hear me now?
Yes.
Okay, all right. Okay, right. If you do find yourself needing
Norley, you are mute again.
Okay, can you hear me? Sorry.
Yeah.
Okay, right. Okay, if you need help from the mental health professionals, either the psychiatrist or the clinical psychologist, okay, what you can do is that for example, certain setengah-setengah universiti dia ada pusat kesihatan pelajar, okay, or any klinik kesihatan or any general practitioner, tak kisahlah private ke apa. So you basically just go to one of these clinics, okay, and basically you are to be seen by the doctor. They are called the primary health care practitioners, okay, and the doctor will basically write a referral letter, okay, to the psychiatric services, okay, and with the referral letter too, you will have to bring to the hospital, that means to clinic psychiatry, okay, and the staff will basically screen through the letter and they will schedule you, they will give you an appointment date. So on the appointment date too, you are supposed to come for the appointment. Okay, if you need to be seen urgently, okay, usually there will be a doctor on call, a doctor on duty 24 hours a day. So the staff will basically inform the doctor on call and the doctor on call will see you if you need to be seen urgently lah.
All right, Norley, we have a few questions from the audience. Okay. Atira asked, Doctor, if online learning is too stressful, how to cope better? Should I quit uni? How to focus during online learning? Thanks.
Okay, I think it is not, online learning has got its own challenges, okay. One is that you have to get used to basically the new platforms that is being used, okay. The second, maybe you will have basically connectivity issues, okay. And sometimes I do understand when you have online classes, sometimes the classes too can be scheduled back to back, okay. So maybe, okay, I think Atira is not alone, okay. Even we as a lecturer pun, when we started online, basically teaching online, it is very stressful for us, okay, to learn the different platforms that have to be used during online. So what you can do is basically practice. Macam practice makes perfect, okay. And if you find it too stressful, joining online classes, macam kalau for example back-to-back classes, try to discuss with your lecturer ataupun your group mates, so that you can have maybe a short break in between lessons. So you have time to relax yourself and then you can come back to the subsequent lesson too fresh. Okay. Does that answer your question, Atira?
All right. Next, we move to question by Daniel. Daniel asks, how to solve sleep difficulties when anxious?
Okay, right. Sleep difficulties. Okay, for someone who is very anxious, okay, they can also experience sleep difficulties. Okay, so one of it that we would advise is to practice sleep hygiene. Okay, right. Sleep hygiene ni, okay, it's not specifically for someone who is anxious or depressed. Okay, for someone who hasn't got any condition, any psychological condition pun you can practice. Okay, so part of sleep hygiene is that you make sure that you go to bed okay, at a fixed time daily. Okay, and you make sure that you try to avoid caffeinated drinks. Okay, for example, tea, coffee, Milo, carbonated drinks. By 6 o'clock, you just stop taking all those caffeinated drinks. Okay, and when you go to bed too, make sure that, for example, your room is dark or ataupun like dimmed. Okay, and make sure that the environment too is very relaxing. Okay, some find it helpful to turn on, for example, soothing music. Okay, some find it helpful, for example, kalau in the Muslim culture, maybe you will listen to Quranic verses. Okay, whatever that can relaxes you. Okay, or and sometimes aromatherapy will also be helpful. Okay, the other thing is that usually, okay, some of my patients, they find it helpful that during the day too, they will basically make time for regular exercise so that your body is tired towards the night, then you can sleep a bit better. Okay. Okay. Any more questions?
The next question by Saifi Zafi. What is the difference between psychiatrist and a clinical psychologist?
Okay, right. The difference. Okay, this is a question that we get asked a lot. Okay, first I start with psychiatrist because I'm a psychiatrist. Okay, a psychiatrist is basically a trained medical doctor. Okay, they have basic medical degree and they go on to specialize in psychiatry. Okay, that means they are specialists in mental health. Okay, clinical psychologists, they have a degree and master's qualification in clinical psychology. Okay, so the difference is, okay, both, okay, I give you the similarity first. Both psychiatrists and clinical psychologists, they can make basically diagnosis, assessment and diagnosis. Okay, psychiatrists, they can prescribe medication. Okay, but clinical psychologists don't prescribe medication. Let's say, for example, if you were to require antidepressant or anxiolytic, then the psychiatrist would have to do that. Okay, clinical psychologist basically does a lot of assessment. That means diagnostic assessment. For example, IQ testing, personality test. Okay, and also they also provide psychotherapy. For example, tadi I mentioned earlier, cognitive behavioral therapy, acceptance and commitment therapy. Okay, so they offer a lot of basically they are trained in psychotherapy and also diagnostic assessment.
All right. Next question by Izriana. How to cope with stage fright?
Okay. I think stage fright can be normal for most of us. Okay, when we start presentation, okay, we can macam have anxiety when we need to perform in front of others or when we need to macam present in front of a meeting, we can have anxiety. Okay, so one of it is to do regular practice. Okay, and the other thing is that if you find it macam prolonged, okay, then you have to, I would advise for you to seek basically a medical opinion lah. Okay.
All right. So far, we already answered most of the questions. I think all the questions. Is there any more questions? Alright, since there's no more questions and we are going to have another webinar after this where we are going to learn on interpersonal skills, because sometimes the interpersonal skills can be a source of stress too, okay, because you are lack of certain skills or you don't know how to talk to others. So we hope we can learn from the next speaker, Dr. Azrina Wati, and the session will be in a short while, okay?
Okay.
And after that, we will also have the other talks on tomorrow as well as on Thursday. Okay, all right. Okay. Tomorrow will be on common mental health disorders, and then also on mindfulness therapy. Okay. Oh, jap. One last question by
Thank you,
Atira.
everyone.
Norley, you accept one
There's
last
another
question?
question? Yeah.
If you
Okay,
already
yes.
take a break, but you still cannot, if you already take a break, but you still cannot focus, what do you do?
Okay. Okay, this is a very tricky question. Again, it depends on the individual. Okay, if you take a break and you still cannot focus, okay, usually one of the helpful way is maybe just to sleep on it for a while, okay, taking a short nap, okay, that will help you to rest your mind and also your body. Okay, and usually the other thing is that it is good to basically have a to-do list. That means you have to manage your time properly and you have to prioritize the tasks that you need to complete in a day. That can also be helpful. Okay.
All right, everyone, I think we are going to end the webinar now. Okay, we'll see you later for the next topic. All right, thank you for joining us.
Okay,
Assalamualaikum.
thank you, everyone. Okay. Assalamualaikum and a very good afternoon, everyone. Okay, we are going to continue with our second talk for the webinar. Right. Our second speaker is Associate Professor Dr. Azreen Wati Nikmat. Okay, she is a clinical psychologist with Faculty of Medicine UiTM. Okay, she will be talking about interpersonal skills, focusing on communication skills. I think this is a very important topic because I think most of us, if not all, do struggle with communication skills once in a while. Okay, all right, Dr. Azlina, you can begin your talk.
Okay, Assalamualaikum and a very good afternoon, everyone. Thank you, Dr. Norley, moderator for my session. Okay, so without further ado, I will share with you about my slide, which is on interpersonal skill, communication, focusing more on the communication. Okay, all right, let me just minimize this one. Okay, when you talk about interpersonal skill, this is actually referring to a set of skill, okay, that you need and you actually use it to communicate and interact with other people. So basically, interpersonal skill covers communication, negotiation, your emotional intelligence, conflict resolution, like how you deal with conflict. Okay, and also problem solving and also decision making. All right, so if you look at the definition of communication, it's actually quite simple. So communication means being able to convey information to other people in a simple and unambiguous way. Okay, meaning that whatever that you want to communicate, make sure that it is straightforward and simple. Okay, tak perlu nak ada berlapik-lapik and things like that. All right. Okay, so in order for us to have effective communication, okay, we need to understand how does a communication process work. Okay, so when talking about communication process, there are a few stages involved. Okay, the first one is the sender. Okay, sender here refers to the person who initiate the conversation. Okay, the one who want to convey the message. And then the second stage is actually the encoding stage. Okay, this actually refer to the words or non-verbal methods, okay, used by a sender to translate the information into a message. So it can be words ataupun it can be a gesture. Okay, it can be written. Okay, so whatever method that you want to use to convey the message that you send. Okay, the next stage is actually the message itself. Okay, and then so this is actually referring to the content of your message. Okay, the next stage is the channel. Okay, channel here refers to the medium that the sender used to convey the message. So it can be face to face. Okay, it can be online. It can be through telephone. Okay, it can be through text messages. So this what it means by channel. All right. So the next stage is actually the receiver. Okay, the person for whom the message is intended or targeted, the one who received the message. And once you receive the message, the last process is actually decoding. So the receiver interpret the sender's message. All right. Okay. So unless it is a one-way communication, normally there's this another stage that we call feedback. So where the receiver actually send feedback to the sender, okay, saying that, okay, I take note of whatever instruction that you give, or I have received your instruction and things like that. All right, so these are the communication process that occur. So it is very important for us to understand this process because, you know, when something went wrong, or people misinterpret the information, you can look into this process and see where is actually the problem lies. Okay, apa masalah, kenapa ada berlakunya miskomunikasi? Okay, at which stage that it occurs? Okay, from there then you can improve your communication. Okay, moving on to the component of communication. So When you talk about communication, you cannot run away from these two things. Okay, verbal communication and also non-verbal communication. Both actually equally important. Okay, because it complement each other. Okay, and it has to be consistent and congruent. Okay, if you say that you like it, your facial expression have to show that you like it. Okay, if you hate it, then it has to show that you hate it. Right. So this, if you look into this communication topic, you may come across this term communication equation. Okay, so communication equation is actually referring to the component in the communication itself. Okay, this was proposed actually by a psychologist named Mehrabian. So there's this study called Mehrabian study, but I'm not going to go into detail in that study. But what important is that most of people misunderstood, okay, about communication, verbal communication and non-verbal communication. A lot of people think that non-verbal communication is superior than verbal communication. Okay, it weighs about 93% of whatever message that you try to convey. Okay, but what does this communication equation really mean? Okay, when the verbal and the non-verbal communication is inconsistent or incongruent, people will pay more attention on the non-verbal cues. So these non-verbal cues here, it depends on what you see and what you feel. Okay, so it depends on the facial expression. People will focus on your posture, your eye contact, your gesture. Okay, here, which is 38%. So this is based on your tone of voice, your vocal clarity, the speed of your speech. And people only pay attention about 7% to the words or to your content. Okay, this is, I'm talking about when the verbal punya communication and the non-verbal communication is incongruent. For example, let's say you say to another person, I don't have problem with you. Okay, so judging from that sentence, okay, if you're looking at the words, I don't have problem with you. So meaning that, okay lah, dia tak ada masalah dengan aku. Okay, but if you take into consideration the intonation of the voice, okay, and also the posture with the hand gesture, okay, and the eye contact, maybe they avoid eye contact and so on. So you more you believe that that person is actually have a problem with you, although the words does not say so. Okay, so that's what it means. All right. Okay. So we've talked about communication process. What is it? Okay. Now we move on to the barrier to effective communication. Okay. What is it that make communication sometimes a challenge to a person? Okay. The first is actually language differences. Of course. Okay. When you talk to another person or when you try to explain things to someone who have different language from you, definitely it will be a challenge. Okay, then you need to rely more on your non-verbal cues like your gesture, your facial expression and things like that. Okay, and the next barrier is noise. Okay, of course, when you communicate with someone, so try to minimize outside noise. So this outside noise can come from, like other people talking next to you, or from the construction at the back and things like that. Okay, so the next one is jargon. Okay, so jargons here refer to technical terms. Okay, it depends on the professional background as well. A lot of people with different background, they have like different jargons. Like IT people, they have their own jargons, landport or whatever not, okay? And for medical doctors, they have their own jargons. Even accountants have their own jargons, all right? Like debit, credit, I don't know, okay? So minimizing these jargons can make communication become more effective, okay? So another barrier in effective communication is lack of interest or lack of attention. Of course, okay, when you listen to something, that you are not interested in. Okay, so definitely you won't pay much attention to it. So you will left with less information compared to those who really pay attention to whatever that being talked about. All right. Okay. Another important point is actually differences in perception or viewpoint. Okay. I mean, it is normal for people to have different point of view about certain issue and certain things. However, if you have this preconception, I mean, in your mind, back in your head, that you disagree with what the other person is saying. So basically, instead of focusing on the point or the message that the person want to share, you are busy thinking about how I'm going to, like balas, or how I'm going to counter back what this person is saying. Okay, so you are not really giving your full attention and try to understand what is actually being conversed or being communicated to you. All right. Okay, the next one is discomfort with the topic. Of course, if you talk about when you have a conversation, and like, for example, I don't like to talk about politics. So if someone talk about politics with me, so the most that I can do, oh, okay, yeah, all right, oh, yeah, I see, So the communication is not like a two-way communication where you give feedback, you give your opinion and things like that. So it's more like macam being receptive of whatever that being said. Okay. So another barrier is distance, right? This is, I think everyone can understand. If you talk to another person like very far away from you, definitely something, I mean, you say something else and they hear something else, and that can create a lot of confusion and misunderstanding. Okay. The next one is emotional. Okay, I think everyone can agree on this. If you are actually angry or you are upset about certain things, or when you're anxious or nervous, then whatever that people say to you at that time, you tend to like filter it out, or you can't really comprehend apa yang orang cakap. Okay, kalau you tengah marah and then people like membebel or say something next to you, you akan macam tak dengar pun, okay, apa yang that person is saying. Alright, so emotional factor. And other people, okay, other people means sometimes you want to say something to your friend, but there's other people around, okay, so that limits whatever things that you want to say. Okay, so time factor, this can be like geography punya condition, like when you have like a different like you have a meeting with someone from different country, so different time, so your concentration will be poor and things like that. So that's how it becomes a barrier. Maybe also when you talk about time, like if you have to present something, okay, as a student you have a presentation, you have a lot of things that you want to share, but because of the time limit, okay, macam Viva for example, okay, time limit, so you really have to focus on what is it that you want to talk about. All right, so these are the barriers that happens or can interfere for a person to have effective communication. So this barrier can happen like any stage in the communication process that I explained to you just now. Okay. All right, so now let's talk about how to engage in effective communication. Okay, so we talk about the barriers, we talk about the process, now about effective communication. Okay, the first one is to engage in active listening. Okay, and I will explain later what does it mean. All right, and then to improve your nonverbal communication, to assert yourself in a respectful way, managing your stress in the moment, because you know that emotional is one of the reason or one of the barrier that can affect your communication. And the last one is how to give a constructive feedback. So how to give a constructive feedback is actually closely related to conflict resolution. Okay. All right. The first one is listening traps. Okay. you need to ask yourself whether you do have or whether you fall into this category. Okay, the first one is mind reader. Okay, when you communicate with someone, do you tend to try to guess what the other person is trying to say? Okay, instead of you focus or listen to the content, but you are too busy like, dia nak cakap apa sebenarnya? Dia nak cakap apa yang sebenarnya? Okay, so you are guessing. So, and you guess might be wrong. Okay, so that's why it falls under listening trap. Okay, the next one is rehearsal. Okay, rehearsal meaning that during your communication, when you were in a conversation with someone, okay, instead of listening to that person, you are busy thinking about, okay, what I want to say next. Okay, what is it that I want to say next? What are the questions that I want to ask next? Okay, like for medical student, for example, because I'm a lecturer in medical school. So medical students sometimes, when they interview patient, okay, if you don't have a good listening skill, okay, you tend to miss out what is actually the patient want or trying to tell you. Okay, because you are thinking about, okay, what are important information that I need to ask next and next and next. Okay, so this is actually rehearsal, one of the listening traps as well. Okay, the next one, filterer. Okay, during conversation, you just filter out things that you want to listen. Okay, the one that you don't want to hear, you ignore. Okay, you only pick the whatever yang you want to agree on or you want to listen. Okay, so that's filterer. All right, the next one is dreamer. Okay, so dreamer means during conversation, you tend to drift away from the conversation, and usually people will say, kau dengar tak aku cakap apa ni? Okay, or you will ask your friend, you cakap apa tadi? Something like that. Okay, so meaning that you don't really pay attention, okay, to what the person is saying, right? There's also a person who can be we categorize as identifier. Okay, so this person, okay, during a conversation, okay, they tend to refer everything to their own experience. Let's say your friend say, I went to Langkawi last week, you know, and then you pun, aku pun pergi juga 2 years ago. Okay, dia kata, lepas tu dekat Langkawi tu, I met my school friend. Aku pun pernah juga jumpa my school friend dekat, I don't know, wherever. So, whatever that you say, and somehow or other, the other person macam ada je benda yang related to them. So this can actually, this is actually one of the listening trap as well, because it just like cut off the mood of the person who want to communicate or convey a message to you. All right, and then the next one is derailer. Okay, so derailer means it's actually referring to someone who changed the subject too quickly. Okay, so when a person talk to you and then you have this tendency to change the subject, so it gives an impression that you are not interested. Okay, and then the next one is spar. Okay, so you hear what is being said but you quickly belittle it. When someone says something to you and then you macam, ya ke, alah biasalah benda tu, you know. So definitely the sender won't feel like sharing the information that he or she intended to share. Okay, and I think this is the last one, placater. Okay, you agree with everything you hear just to be nice or to avoid conflict. Okay, like when someone says something, betul tu. Yeah. Okay, so this is so instead of having a two-way conversation, okay, where you can share your opinion about certain things, but being a placater, you just like agree to it. So it's more like a one-way communication rather than a two-way communication. All right. So that is the listening trap that you have to be aware of if you have, okay, because if you have, then you have to learn how to change that in order for you to have a effective communication. All right, so the next one, okay, to improve or to have an effective communication is actually to improve your non-verbal communication. So this refers to eye contact, okay, when you communicate with people, you look at the person's eye, okay, but remember not to stare, okay, but I also have problem with this eye contact, okay, and then body language, okay, you have to be aware and mindful about your body language, you know, like whether you look defensive, whether you appear defensive to people, or relaxed, nervous, and things like that. Okay, your facial expression is also important, your appearance, okay, your tone of voice, right? It has to be consistent with the message that you want to send. Okay, so space refers to the distance between you and the other person. Okay, you don't want to talk to a person like too close and make a person feel uncomfortable. Okay, and you don't want to stand like too far away. That can make the message that you try to convey distorted or confusing to the listener. All right. So the next one is actually asserting yourself. Okay. So a lot of people mislook on this area. Okay. So what does it mean? Asserting yourself means you use the word I. Okay. Try saying like I would like or I feel. Okay. Instead of he is like this, dia ni macam ni, dia tu macam tu, okay? But you focusing more on I rather than he or she or whoever, they, okay? And then make an effort to use good eye contact, okay? Don't stare, okay? Use a good posture, keep your back straight, okay? And avoid ambiguity, okay? Like if people ask you for your opinion, okay? Don't say, I don't know about that, I don't know, maybe. Okay, so if you're not sure or if you don't like certain things, so you just say, I'm sorry, I'm not comfortable doing that. I'm sorry, I have something else. Okay, so be confident to assert your opinion and whatever that you feel about certain things. Okay, and of course, to have a good communication, please avoid swearing. Okay, don't critique people. Okay, and you have to take responsibility of your words. Okay, so the next one is managing stress. Okay, to have an effective communication, you have to be able to manage your stress at that time. Okay, so you can try to control your tone of voice. Okay, if you think that your voice is start to raise, then take a deep breath. Okay. So Dr. Norley have shared with you just now about stress management, some relaxation technique. Okay, this is one of relaxation technique as well. Okay, you just imagine a stop sign. So you stop, you take a breath, okay, and you observe the situation. Okay, you observe the non-verbal cues sent by people around you. Macam diorang nampak comfortable ke, diorang nampak tak comfortable ke, then only you proceed. Okay, so the next one is constructive feedback. Okay, so how to give a constructive feedback to someone. Okay, when you disagree about certain thing, okay, the way to actually dealing with it is actually to focus on the problem. What is actually the problem? And you have to be specific. You cannot say, aku ada masalah dengan kau. Okay, so what is your problem? Everything. Okay, that is so not specific. Okay, so you have to be specific. What is it that you are not happy about? Okay, and focus on that. All right. Okay, and then you talk about the situation and don't attack the individual. Okay, so you talk about the issue. What is the issue? Okay, you don't talk about this person, that person buat macam ni, orang ni buat macam ni. Okay. So it just will create like another drama and conflict. Okay, and give praise where it's due. Okay, Macam kadang-kadang our society ni macam mahal sikit when it comes to, praising people. Okay, memberikan pujian. Tapi when it comes to criticism, wow, okay, macam agak laju. So we have to be fair. Okay, when we think that that person deserve a praise, so give a praise. All right, and then be direct. Okay, listen. Okay, you listen and you need to give the person a chance to respond. You listen to understand, okay? Not listen to fight back, okay? And then make it timely, okay? Like, meaning that kadang-kadang you nak bagi constructive feedback also, you have to look at the situation, okay? Whether the time is actually suitable for you, whether it's the right time to talk about that thing, ataupun macam, okay, it need to be postponed slightly later when everything is calm. All right, and then provide a balance of positive and negative feedbacks. Okay, so normally when people want to give feedback, okay, they will start with, okay, thank you so much for okay, I'm giving example as a reviewer. Sometimes kita kata okay, this is a good write up, you focusing on this. However, there are a few things that you can improve, and then they start giving the negative feedback. So don't just give a negative feedback and leave the positive feedback aside. Okay, you need to balance these two things. Okay, and be aware of feedback overload. Right? So you don't want to overload people with information. All right, just pick on what is important and what need to be addressed. Remember, communication is all about being simple. Okay, so the last section of my sharing today is on the 6th step for giving constructive feedback. Okay, how can you give a constructive feedback to someone? Okay, again, okay, number 1, you need to state the constructive purpose of your feedback. Okay, like, I have a concern about certain thing. I feel that I need to let you know about blah, blah, blah. Okay, pay attention to the word I. Okay, then next, you describe specifically what you have observed. Okay, yesterday afternoon, okay, this is example. Yesterday afternoon, when you were speaking with Mrs. M, I noticed that you keep raising your voice. Okay, so it means that you describe what is it that you observe, right? So after that, you describe your reaction. Okay, so the staff member looked embarrassed and I felt uncomfortable about seeing the episode. Okay, and the next one is give the other person an opportunity to respond. So what was it about? Okay, what do you think happened? Okay, what is your view? Okay, tell me what's your thoughts. Right, so as you can see, the punya stage show. Okay, so it start with how you feel and what you observe and your reaction, and then you give that person an opportunity to explain, right? Then the next one is actually you offer a specific suggestion. Like rather than telling Mrs. M in public, you might try to speak to her in private. Okay, so you give suggestion how to improve the situation, right? Because you can see from your observation that other people not comfortable, you also don't feel comfortable. So you give a suggestion, okay, what can be improved, right? And then summarize and express your support. Okay, now that we talk, at least we understand each other better. Okay, so I will do my part, and you will take note of the punya concern and things like that. Okay, so this is actually my last slide. Okay, so communication and also technology. I just want to touch briefly on the communication and also technology, because nowadays we rely on technology a lot. Okay, so remember the communication equation that I shared to you just now. Okay, so instead of you have the words, the verbal, the see and hear, the see and feel and the hear component, but when technology comes in, it becomes limited. So for example, if it is phone conversation, your 100% will be coming from your hear, okay, which is 38%, and the words that you say. Okay, so how is it that you want to maximize this to 100%? Okay, because when you talk through phone, people cannot see your face, cannot see your facial expression and things like that. Okay, so this can be improved by control your by have a body control. Okay, what does it mean? It's actually, you know, like sometimes when you upset about certain things but you want to control it, then instead of talking to a person standing up, then maybe you can sit down, okay, and then you can try to control your breathing. And the good thing is that people cannot see you, so you can draw silly things, okay, on a paper just to distract yourself, okay, and to calm yourself. And you can send listening signals like okay, all right, you know, so that's what it means. So you are telling the other person at the other side that you are actually listening to what they say, okay, rather than you macam keep quiet je throughout the conversation. Okay, and the next one, this is more important because nowadays we do a lot of this, you know, like sending email and also WhatsApp. Okay, so this is basically how to turn the 7%, because it's only like a written word. There's no like facial expression, there's no like tone of voice in the WhatsApp or in the email. Okay, and this 7% is difficult for you to make it like 100%. Okay, so if you want to improve your communication when it comes to sending a message or an email, so you can, you know, like type whatever that you want to say in the email or in the document or whatever, but make sure that you don't send it out. Okay, so spend some time to read it again and again and again to make sure that, so bila you read it again and again, you akan tend to remove, this is actually not important, you know, this is actually not important. Because if it is too much information, then it will cloud the purpose or the content of your message. Okay, so you read it again, and then it's okay to ask other people to get a second opinion, okay, whether this is okay or not. Okay, so you begin with the intention, you end with the direction, where it means like, okay, I'm writing to you to blah 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 blah. Okay, and then end with direction. So depends lah. So I'm waiting for your reply, or I hope that you can give certain whatever. Okay, so they are the intention, they are the direction. And sometimes emoticons helps. Okay, like if benda tu macam serious, then you janganlah letak emoticon yang funny and things like that. Okay, so emoticon can help to reinforce the message that you're trying to send. Alright, because you know, like with the message, you don't have that other component like facial expression, the gesture. So emoticon can be a substitute to it. Alright, so that's all for me. So I think I pass it to Dr. Norley to open for Q&A.
Okay, thank you, Dr. Azlina. Right, we have two questions from the audience. We will go to the first one first. A question from a student here. How do we communicate with difficult people who always look at things negatively?
Okay, so how to communicate to difficult people who tend to look at things negatively? All right. Well, first, you have to keep your expectation right. Okay, you know that certain people are not as receptive as other people. Okay, because if you put like high expectation, then your level of frustration will be higher. Okay, so you have to be mindful, meaning that, okay, for example, okay, I'm trying to say this to this person, but I know that most probably that dia tak akan listen to whatever advice that I want to give, but I'm going to try anyway. Okay, so that's what it means. The right mindset before you actually communicate to this person. Okay, and it also helpful if you can try to understand why is it this person become difficult. Okay, macam what is actually dia punya issue? What is it that they're dissatisfied about? Is it you, or is it because of you, or is it like general? Okay, if the information that you want to convey is important, and you know that you may be the source of dia punya difficulty, so maybe you can think of, instead of me relay the message, might as well you approach your other colleague who you know that this person more receptive of. Okay, so dia lebih receptive dekat kawan you. Kalau kawan lagi seorang ni cakap, dia lebih mendengar. Okay, so then you can approach that person and ask that person to convey the message. Because the most important thing here is how to send that message across. Okay, not like to force that person to listen to you. Okay, so yeah, priority. Okay, priority. And yeah, I guess yang tu lah kot for now.
Okay, we have a second question. How to interact with people of different generation because they don't know what our generation is going through. Referring to the students lah, the generation gap.
Okay, so I'm assuming you are from an older generation? I mean, how to interact? Macam mana?
That means the generation gap lah between, for example, the young ones now and, for example, the lecturers or parents, for example, their parents.
Okay. The thing is, where it depends. Is it the older one who have the difficulty to understand the younger one, or is it the younger one that have difficulty to understand the older one? Okay, but regardless, okay, first you don't have to be pretentious. I mean, you don't have to pretend to be someone that you are not. Okay, but it's good for you to try to understand and put yourself in the person punya shoes and try to understand where does this coming from, Then bila you faham, okay, let's say for example, okay, I'm giving an example of parent yang macam tak bagi anak dia keluar malam. Okay, but for younger generation now, like keluar malam as long as you balik before 10 is something yang macam okay what? It's not an issue. Like my friend yang lain pun macam tu. Why is it that my parents macam so skeptical or macam sangat disagree or sangat rigid about certain rules? Okay, so you can try to understand, of course. Okay, bila you bandingkan, you akan rasa macam, oh, this is not fair, and you rasa like dissatisfied. But try to look at what are other things that your parents allow you to do and other parents don't allow their children to do. Okay, and as a parent, maybe if you put yourself dekat you punya parents punya position, then you akan rasa macam, okay, mungkin kalau aku ada anak pun I may think of ni, but maybe not to that extent. Okay, but at least you ada sedikit macam cuba untuk faham. And as a parent also, okay, you can think, you can try to put yourself in anak-anak you punya situation, like sekarang ni macam it's not like sama macam dulu, blah blah blah. But all this can start with a good communication. Okay, So when you have a disagreement or benda yang you disagree because of this generation gap, okay, you can always have a open communication with your parents. I mean, if this involve your parents lah. Okay, cakap macam actually macam understand blah blah. You know, you read the constructive. You go back to the steps just now. Okay. So maybe that would be helpful.
Okay, Dr. Azlina, we have a third question. How to ask your lecturer to explain in a method you might understand during online learning? Even if the lecturer explain again, still tak faham-faham. How to understand faster?
Oh, well, that is quite broad. Is it like something like really technical ke? So basically, okay, I think it's good. Dia macam ni. How to improve that? Okay, what I can think of, if you don't understand about certain things, okay, and then you ask your lecturer to explain it to you, and then the lecturer explain it again, and you don't understand. Okay, it's good if you can tell the lecturer what is it that you understand, so that the lecturer know where to fill the gap. You know, like instead of macam, oh, I'm sorry doctor, I don't understand. And then the lecturer pun dia akan repeat again. Okay. Lepas tu cakap, I'm sorry doctor, I still don't understand. Okay. It's good kalau kata, what is it that you don't understand? So maybe you can say, I'm sorry doctor, actually I still don't understand. What I understand from what you explained is that this caused this, and this lead to this. But I don't understand how this related to this. You know, then the lecturer can explain the part that you don't understand. So this is where the feedback comes in. You know, the communication process, you have the sender, you have the whatever thing, you have the sender, you have the message, the channel, and things like that. So the feedback, so you have to give a precise feedback. Okay, you have to be, bila you nak bagi feedback tu, you kena bagi tahu apa yang you faham, apa yang you tak faham. Then baru senang untuk the lecturer to explain it back to you, rather than dia kena explain like the whole text or the whole topic from the start until the end. Okay. Alright.
Okay. Thank you, Dr. Azlina. Is there any more questions that you all want to ask Dr. Azlina before we end the session? You can still type your questions. I've got one question. How do you improve your listening skills when you are easily distracted? While waiting for the other questions, yeah.
All right, how to improve your listening skill? Okay, it's good if you can take notes. Okay, means that you jot down the key points of whatever that being discussed. You know, like sometimes listening to talk or listening to lecture, it can be like it can be like very tiring and difficult for you to focus. Okay. But by taking notes, okay, you identify the key points and things like that. So at least macam you won't miss out a lot. And sometimes bila you look back at your notes, then it somehow ring a bell. This is actually talking about this. These are actually talking about this, you know. So that one of the tips that I can share lah.
Okay. All right. I think there's no further question. Okay. I would like to thank Dr. Azlina Wati for her informative talk. Okay. As a summary, communication skill is very important. Okay, it involves verbal, non-verbal, and also listening skills. And with any skills, it requires a lot of practice. Okay, it's something that you have to do repeatedly to master. Okay, right. Don't forget to tune in to our webinar tomorrow. We will have Associate Professor Dr. Azlina talking about common mental health issues in students. And also Dr. Jana will be speaking on mindfulness therapy. Okay, same time, 12:30 to 2:30 tomorrow. All right, thank you everyone.
Thank you. Assalamualaikum.